Thank you, everybody, and welcome to another show of The Girls. We're so happy to have you here. We're at Mia's in downtown Hazleton, and we are going to have a great show, aren't we?
We're ready, girlfriends, right?
Yeah, I'm really, I think everybody out there is really going to be interested in what we're talking about today, because everybody, every girl, no matter what, when you look in the mirror, no matter what age, sometimes you're looking and you say, where did this come from? Or where did this wrinkle come from? One of my kids, or was it just, from cheerleading or from, whatever. But as we get a little older, sometimes we look and we say, gee, I didn't have that. How can I get rid of this? So we took a little visit to see Dr. Schleicher this week. And Dr. Schleicher is a very well-known dermatologist in our area, and he performs miracles.
He does. Before we get to the miracles, I was looking back. You don't realize until you look back at pictures of yourself. And both of my kids needed pictures from when they were born, when their baptisms were, and I'm looking back and thinking, oh my goodness, that was only 6 years ago. So
yeah.
Well, gravity takes over.
Wait till you get to
right?
my age. And you look back at you when you were a kid, and I look at, the way that time has shown itself on my face.
Right.
But in the same token, now with all the great things they have for our face, we don't have to worry about going under the knife. Wouldn't that bother you to go under the knife to get a facelift?
I mean, yes and no. I guess it would have to depend on the situation, but I definitely prefer not having to go under the knife.
Yeah, because it's not only the knife, it's like the anesthesia and the whole bit that scares me.
I had plastic surgery when I was 9 on my nose.
Really?
And it was because I had broken my nose twice, and it was very crooked, which people tell me it still is. But my mom, opted to have it fixed then instead of waiting down the line to have the plastic surgery done to it. So I had it fixed then, which I thank her every day for making that choice to do it. I remember getting hit in the face with a softball, and I remember getting double whammy then at another practice with a head, and it just broke in the same place twice. And I remember going, yeah, I remember the surgery. And I came out, and I was swollen to no end, but in the end, I was happy she did that for me then and didn't make me go through school until I got to a point where I could get it fixed,
I found that in 2007, the recent study that I found, there were about 11.7 million cosmetic procedures performed in the United States. 91% of those were performed on women, which is no surprise that mostly women would get some work done.
Yeah, but more and more men are getting it done. Like they're getting those deep creases removed in their forehead and the laugh lines, those puppet lines and whatever. And hey, if they're going to have young hot mamas that they're married to, they may as well look good too.
Right. I saw a guy that got calf implants.
Huh?
Calf implants. He was really addicted to working out, and his calves would never get big, so he put implants in his calves, like boobs in the back of your legs.
I guess
everyone wants something, right?
He had major cleavage.
Right.
Yeah.
Well, in addition to the plastic surgeries, though, there are a lot of procedures now. We've come a long, long way from the plastic surgery days where everything that you wanted to have done, you had to have surgery done. So now there's, like you mentioned, with the different fillers and the Botox and a lot of new procedures that you look like you had a facelift, and you could go and have it done on your lunch hour.
And
which
the
is
nice
really
thing
great.
about that, and we'll talk about that when we have Dr. Schleicher on, but you think, I don't need this yet because I'm in my 20s or I'm in my 30s, but the younger that you get these minor procedures done, you could actually prevent some wrinkles. And we are actually at Dr. Schleicher's office because, as you know, we have the show called Skin Sense, and he performed a little procedure on me, so we're going to give you a sneak peek of that procedure. One of the most popular questions that I've been receiving has to do with Botox and fillers. So we're here with the main man, Dr. Schleicher, and he is very comfortable at doing Botox and fillers because you do that almost every day.
We do just about every day, yes. And I guess we're going to fill you up.
Fill it up.
But not really, because we actually use fillers to fill people up. Fillers are different. What we're going to do today, you can see Janine has some little lines up here. She's really good here. Okay, so we really don't have to put an awful lot of Botox in here.
Okay.
But, some women like the eyebrows lifted, okay, and Janine just doesn't care for that look, so we don't really do too much in the eyebrow area. But she does get creases here, which she's had Botox before, so it looks really, really good actually. But people, over time, Botox starts to wear off, so it generally can last about 4 months or so. And the good thing is it will actually train your muscles over time. So the hope is that you'll even need less as time goes by.
And people have asked about deep creases. Oh, I've had this, Botox isn't going to take care of it. It definitely does, because I had a deep crease there when we first started doing the Botox.
Yeah, and the crease is out, so that's a really good thing. You know, before Botox, there was not great treatments for crease. You know, people would undergo facelifts and spend thousands, sometimes $10,000 for something you can accomplish for, you know, $200, $300, $400. So it's kind of neat in that regard. But what we do with Botox, we go, it's very, very easy to do. And we go right in this muscle here. There, that's one of the key muscles. And then when we're talking about creases, and then what we do is we put a little bit here, there, and we put a little bit on this side. Now again, some people want more of a brow lift. Janine doesn't, so a lot of times in women we'll put here and here, but now what we'll do is concentrate, make a frown, Janine. And you can see she still has some creases there. Okay, you can relax now. And so we'll put a little bit up here, there, and then we go basically across the brow to actually take out or prevent any new lines from occurring. And the nice thing about Botox, it doesn't have to be exact. The Botox, you put it in and it will actually spread out. So that's why we don't need too many sticks. And we'll put some up here. And this basically will prevent Janine from developing those kind of frown lines and creases that, you know, nobody wants. You know, why have them if you can easily get rid of them? There, there, there. And that basically is it. Sometimes Janine doesn't really have any crow's feet. They're gone. So if she had crow's feet, we would do this area here and this area here. People can get a little bruising in this area here, which lasts a week or so. That's about the only real side effect. Sometimes the eyelids can droop because there are certain muscles up here that are connected. And you know, if you get droopiness, it usually lasts a few days at the most. Sometimes it can last a little longer. Side effects from Botox are never permanent because it just wears off. So, and you see, and it didn't really hurt too much, right? She's a good patient. Doesn't really hurt at all. So, yeah. Yeah, and then hopefully next show you'll notice she'll look like she's perhaps 16 or 17.
That would be amazing. Thanks,
yeah,
Doc.
she always acts that way, but now she'll look that
13.
way.
So there you have it. I would never think that I would want to get the Botox done. I had such a big crease in my forehead, and it's completely gone.
Wow,
It
very
didn't
cool.
hurt at all.
Good.
Okay, we'll stay right there because when we come back, we're going to meet Dr. Schleicher and see some additional procedures.
Yay.
Welcome back. As promised, we have a special guest here. This is Dr. Stephen Schleicher, and he's a very well-known dermatologist in our area, and he is here to talk to us all about the non-surgical procedures that even you can have done. They're affordable, they're painless, and they have great results. So, Doctor, welcome to the show.
Well, thanks for having me.
You're our
here with
first
four
male guest.
Outrageous women.
Yeah.
I hope I don't pull a Rush Limbaugh on you guys.
Uh-oh.
So
Well,
we're in trouble.
we have an audience filled with women to protect us.
Oh, good. Good. That's
Are you
reassuring.
sweating it? You're out.
Yeah, I'm sweating.
You're way
yeah, I'm
outnumbered.
sweating. I'm sweating.
Are you having a hot flash?
So, yeah, hot flashes. Yeah, I took my hormones today. I'll be fine.
Very good.
So,
All right, so I came to visit you, for everybody to know. Janine was doing a show with you called Skin Sense, and she called and said, well, when you're done your taping, just stop by. And I was just thinking, well, I'm going to go there and get the little shot of Botox in my eye like I always do because I have one of those twitchy eyes. And so the Botox freezes the nerve and takes care of that eye. So I walked in, of course, everybody who was there said, oh, she's perfect for this. And I'm like, perfect for what?
Oh, boy.
Here comes the guinea pig. So before you know it, I was having a seat in the office.
we held her down.
Held me down.
We kind of beat her up because she's a
Beat her
little bit
up.
bruised here.
Yeah,
but-
so why don't you tell everybody
well,
what you did?
Yeah, what we did, I may even have it on me. What we
It
did
just
was,
happens
yeah,
to
gee,
have
what
a lot
a,
of syringes
what a coincidence. I just happened to have this. But what we did, this is called Radius. Okay, this is actually made out of calcium. and it's used to fill in lines, which we all get. You can feel my cheeks. I had some myself. I mean, no, not
What
today.
cheeks?
No, but you're. Wow, wow! You can't see that. That was under the table.
I think your hands.
So, yeah, we have to watch. Can I move a little bit further this way? Anyway, this is what we use to correct, like wrinkles and whatever.
From smiling.
From smiling and whatever. And of course, as we get older, we just lose muscle mass in our faces. And this is really, really neat. It's actually a very soft product, okay? And it's very easy to utilize. Really, the only side effect is bruising, which you got, which lasts.
A ton of makeup on.
Yeah, which can last a week or two.
My mom looks like she had a facelift. Look at her, and she didn't have a lot done.
Here's the funny thing.
Well,
it was in a
we-
little vial that you showed us, and
Yeah,
he
it's fine.
shook out this white powder. It's just calcium. It's
Just to
ground
show you what it
calcium
looks like,
before you
right.
mix the
Right,
solution.
and of course calcium is a part of us. Bones are made
bone.
of calcium, so it's very safe. You can't be allergic to something in you. And it's just a real 5-10 minute procedure, and you fill out these lines.
And I can't believe it doesn't hurt. I keep saying that because it really doesn't hurt.
It
I'm
didn't
not
hurt.
just saying it doesn't hurt.
Well, it actually, this
And
one
there's
actually,
numbing medicine.
yeah, it has numbing medicine in it, so that's the reason why it
It
doesn't
feels
hurt.
like you went to the dentist.
Can I hold that?
So well, I don't know. I'm
Yeah,
sitting
can-
next to you.
Yeah, do I
No,
trust
fine, I'll
you?
take
Yeah.
that home.
Don't run out the door with this, all right? Yeah, you can hold it.
They have
Yeah,
to be in trained
so-
hands, of course, because you were very specific about where.
Can I get that back, please?
Yeah, where can you put this besides your face?
Well, we use it in the hands, okay?
hands?
Because again, people get
you
older.
believe that? In your
you
hands?
get
Well,
older.
here's the thing with my
it's-
hands. I have these skinny, I had bony hands, and so all the bones in my knuckles had started like caving in, I guess. And every time I look down at my hands, I think, why is my skin so thin I could see like every vein? So Doc said, oh, geez, well, we'll just put a little bit. So he put a little bit in between each knuckle, and just so like this. And when I went home, I did what your rep told me. She said, just get some heat and put it on and sit on your hands. So I went home and sat on my hands for about 45 minutes. And I took my hands and I went, oh my God, they look like they're 19-year-old hands.
I know we're showing
It's like,
video
oh my
too,
God.
but also with my mom's hands, you could see the veins.
The
before,
veins,
and now
they're
you
gone.
can't.
And we only use a very small amount. And again, pretty painless.
It was
So, yeah.
So
Totally
you can put it in
Yeah.
your face, your hands.
Face your hands.
Your
and that's,
butt, right?
Can
no,
you
we
put
don't
it
do
in-
butts. No.
So it's-
I would not recommend it for butts, okay? So we don't do butts.
You
all right?
mean, you
Forget
mean the
butts,
cable
all right?
guy
I
can't
mean,
get it put in the crack so that when he bends over, you don't see
Not
that?
your
Oh,
butts.
okay.
Actually, you could, but I
So
would
you
not.
can put it in like
Yeah,
cellulite and like,
That's a very good point, because unfortunately there's no great treatment for cellulite.
yeah, tell me about
You
it.
would think that the fillers would work because you get these lumpy areas, but we've tried fat transplants where you take actually fat cells from your stomach, put them in the cellulite to even them out, but it doesn't work.
What was the first thing I said to you when he said, well, I'm just going to put, to get the parentheses around the
Yeah.
cheeks? And I took the
Very
mirror and I
nice.
said, Doc, I'm going to watch it and I don't want to look like Joan Rivers. If I look
love
like Joan
Joan
Rivers,
Rivers.
or if
She's
I look
not-
like, some of these people who went over the top, he said, well, first of all, you can never look like that because they've had facelifts and then they had cheek implants and they had all other stuff done. And all I had done was just little tiny lines on the sides of my mouth. And when you filled that in,
Lift your whole
it's
face.
sort of like just evened out. It's almost like somebody ironed across right in here. And all it was these two little needles.
And then he did
It's like,
right
oh my
here,
God.
which
Yeah,
lifted the
you
skin
like to
here.
do
and
that.
Well,
your
yeah, right on the
But you
cheekbone.
made a very good point because you don't like to overly Botox people.
And that's
okay?
why I like how you
Some
do it.
people insist on getting like massive amount because they really want to look like they're plastic.
Do you
Could
trim
you
them
imagine
down?
not being able to
Yeah,
speak?
I try to talk them out of it. I say you really, but I mean I have to tell you, I've had a couple of reps for the company who I actually treat who insist upon full Botox, and they look kind of like they're full Botox. Well, why do that? I want to see people walk out who look natural. It just depends on you. So,
Well, when we come back, we're going to go to our segment, Let's Talk About, and we want to get the audience's questions about that. It could be on any topic, but I know that you have some questions about fillers and about those lip injections. So stay with us here on the show.
Welcome back to the girls. Our guest today, Dr. Stephen Schleicher. He's a great dermatologist, and we've been chatting about different things, and now the audience has had a chance to ask questions as well. And Doc, I think you have a question there that someone sent up here for you to answer.
Well, somebody asked, isn't Botox like poison? It's a great question. And, well, you know, a lot of medicines are like poison, okay? Digitalis, I'm sure you know, it's been around for like 50 years, will kill you, okay, if you take too much. Botox, well, the same thing, but obviously, you know, there's been like millions and millions and millions of people who've had Botox. It's just a real dilute strength of this so-called toxin.
So people shouldn't be making their own Botox.
And people shouldn't be giving themselves Botox.
Correct.
Well, you know, there are there are other products that are very similar to Botox. There just came out Dysport, Xeomin, are the new Botoxes on the block, but they're perfectly safe. They're made by reputable companies. You don't want to make your own Botox. Let's put it that way.
And then what's this little box you have here?
Well, we talked about the
Goodies
lips.
for the lippies.
Yeah, we talked about the lips, and we don't use the previous product on the lips because it's a little too thick. But we use a product like this. I don't know, well, it's very clear, okay, and it's called Prevel Silk.
Oh, Prevel.
And we use this to actually, okay, build up the lips.
Which we didn't do on me yet.
No.
So it's a gel.
No, but you know, some people have very thin lips, and they look great with just, you know, you put one of these little syringes in, and you have like nice.
But how do those little lips?
This is different, and you didn't mention the clumping, because this stuff doesn't clump, and you don't want it to clump in the lips. So there's different formulas.
So if you have little baby lips and you put this Botox in, and then they're like,
they're not that big.
then when the Botox goes away, do your lips sag?
Well, you don't use Botox.
This is a Botox.
Or I'm sorry, filler.
This is a
filler.
filler. No.
Yeah,
they
so
do-
how long does it last?
No, what these products do is
It depends if you smoke.
Well, that's true too. Yeah, if you smoke, you're gonna
Get more wrinkles and it's gonna last.
Smoking destroys collagen. Okay, one of the bad things about it. So, if you worry about wrinkles, you don't want to smoke.
And you don't want to be in the sun.
But no, you don't use Botox on the lip. You mentioned
I'm
Botox.
sorry, yeah,
No.
I'm not-
What happens is this just naturally goes away. Okay, your body just slowly absorbs it, and then you're back to where you were.
Okay.
But we use it too for, say, acne scars. And what we're actually doing over time is we're actually promoting your own collagen to help fill the scars as well.
Okay, so this stimulates your own collagen to come back.
Over time, yeah, a lot of these products do that. Yes,
I have
absolutely.
a question here
Absolutely.
that talks about the negative and positive stigma for getting the Botox and fillers. Listen, if I'm getting Botox or fillers, and everyone could know about it, and if I get a boob job or anything else, we'll share that with you too. I'm personally not embarrassed to say what I get done. I think it's my right to get what I want done with my body, as it is for you. And
I mean,
everybody else
I'm a little
watching.
embarrassed
Are you?
because, for instance, I didn't tell you guys, but I actually went to get filler in my cheek because I had acne scars. So what he did was the little holes in my cheek he filled with the filler, and over time, the more you do it, the better it looks. And it's embarrassing saying it, but at the same time, I feel like for other people that may have like a little indentation or scar, it works, and it gave me more confidence because it's
And
a
that's-
Well,
hard.
that's
That's
the
the
whole
key.
thing. Who did you do it for? Did you do it for everybody out
Exactly.
there, or
Did it
did
for
you
you.
do it for yourself?
Hey,
So
if I get
that's
a
what you
boob
do it
job,
for.
you guys will be the first
Awesome.
to know.
Yes.
Can
Yeah.
we
That's all there
record
is
that?
to know.
Can I
Can we
perform?
record that?
You know,
Double Ds.
You know what's really funny? Like, women are getting cool about this, but a lot of men, it's like, top secret.
Right.
And I read an article where they're actually calling it Brotox. Okay, which is, how cool is that?
That's awesome.
for all the guys who are getting it. And you're getting younger and younger guys getting it. But, they had to come out of the closet. You know what I mean? It was like a women's thing. And like, we get these they don't want anybody to know. It's like, whatever. But now, socially, we have 25-year-olds, they're bragging to their friends that
Right.
had
And the
Botox,
thing
they
is,
had
the more we
fillers.
talk about these issues,
you
the
go to
more
South
it's-
Beach, my God, that's all
Oh,
they
my
talk about
goodness.
in the bars. You know what I mean? Like,
Right.
I won't tell you where else I went where they talked about it, but yeah, they do.
I think
That's a whole other show.
Well, it's personal
It's another
preference,
show.
really, because I am not against it at all, but I don't want it done. I don't want anything done to my face.
Well, you don't
or
need
my,
anything yet.
Yeah.
Look at
Well,
you.
thank you. I appreciate that. I feel natural, and I want to stay natural for as long as I can.
Right, but if something
But if
starts happening,
if something starts happening, of course, I'm not going to be against it. But I don't know. It's
we'll
to
see
each
you
his
in
own.
5
I'm
years.
El Natural.
And what did you learn here?
Speaking of Skin Sense, Dr. Schleicher wrote this book, so we want you all to pick this up. Amazon.com, Barnes & Noble, or you can just go to Dr. Schleicher's office, make an appointment, go see him, see what he can do for you, and pick up a book.
And you not only do the Botox and the fillers, but he helps people with looking at their moles. We've done shows on acne. That's another question on treating acne and dry skin, protecting your skin from the sun.
Well, that's
we only
where
have
all
a
the
couple more
damage
minutes.
starts
Yeah,
because a
right.
lot of people will lie in the sun thinking it'll hide their acne, marks, or if they have, bad skin and they'd start drying it up with all those products, Doc. I guess that damages the mantle of your skin.
Yeah, there was a question about how do you treat adult acne.
Right.
And it's amazing because we're seeing more and more adults, especially adult women, breaking out. Okay, so one of the problems with acne is that if you don't treat it, some people can get scars. And scars are kind of permanent. So you do want to treat it. And there are topical prescription medicines you use, and if you're bad, then you need something orally. So, and you mentioned about moles and whatever. Well, yeah, that's another show, but just realize there are 2 million new cases of skin cancer every year in this country. So that's an epidemic. So we encourage anybody who sees something they don't like the looks of, by all means get it checked out. Because skin cancer, usually it's not going to kill you. It's just going to eat into your skin. But there are a number of patients who die every year because they neglected their skin cancer. So you don't want to be one of them.
It just gets out of control.
Right, get it checked.
Well, as usual, the time always goes flying by. We have a lot more questions. You could visit us on Facebook, and we can answer some of those questions there. And, of course, you could check out our site and get your own questions answered. Dr. Schleicher, we want to thank you for joining us today.
As always.
And
I can't wait
next
to be
time,
back.
We're going to
This is
talk
great.
about body image. It fits
Right.
right in with the season of spring.
Right, and we want to thank our host here, Mia's, down in downtown Hazleton. We've had a wonderful time here tonight as usual. We've had some great food and great drink, and don't forget to tune in to the girls next time because we're going to talk about body image. So have a great week, and we'll see you next time.